life is a highway, then I would want our next guest to be maybe driving the bus. Angela Morton joins us this morning from Recovery is NWPA. Angela, good morning.
Good morning, Luke. Thanks for saying that, but that's a scary prospect, me driving the bus. I don't know about that.
I'm being polite.
I'm being polite.
I saw the damage on the back of your car.
No, you did not.
No.
Thank you, though. Thanks for having me.
Well, we talked to you last month, and a lot of great information. There's always something going on, Angela. You're always involved with something, and folks might know you from Recovery Is that airs on Armstrong's Neighborhood Channel, and you have a lot of great guests with a lot of great information. Where would you like to start today?
Well, thanks for asking. We always start with that, right? I walk in, and now I've been here enough times and appreciate the platform to get some information out there in the community. So I always say, what do you want to talk about today? And sometimes we have the off-camera conversations that blur into the conversations we have here. But really the message is we have a grant project called Recovery is Community, NWPA, and it's through the Rural Communities Opioid Response Program. So it's a federal grant that was given to our area, and we're working to increase access to substance use treatment. So treatment for drug and alcohol concerns, or alcohol and opioid use disorders specifically. So really just talking about it, getting people comfortable talking about it to reduce stigma, because one of the biggest problems with people having access to treatment is nobody wants to talk about it. There's so much shame and stigma and judgment about addiction, and people just don't know where to turn, or are afraid the places they have turned and tried to talk about it, it didn't go well, so you suffer quietly and don't know where to get help.
So where's that come from? Is it there's so many places we could go with all of this, but in terms of the stigma part of it, is it because we've talked about folks who struggle saying, I have a problem, I need help, right? And then there's, well, I don't want my family to know or my friends to know. Is it two separate camps that kind of bleed into each other, or do you find that it's pretty common across the board where I don't think I have a problem, but if I do, I don't want them to know about it?
Well, I think any problem we have, it takes courage to speak up. If somebody's going through, if your kids are having problems with something, or you're going through a divorce, or you lose a job, or any big changes in your life, so struggling with a condition that people don't understand. So I don't know that it's different camps. I just think that when you're struggling with a condition that people don't understand, and you hear people talking openly with a lot of judgment about, then it makes you cautious to ask for help. So even when fire, police, quick response, ambulance, first responders tell me that sometimes they go on these calls, and it's really common that somebody has an accidental overdose while using drugs to try to make their withdrawal go away. It's not always about trying to get the euphoria or the high, that they've gotten into this addictive cycle, and you compulsively have to keep using something to make that withdrawal go away. So they're trying to make that withdrawal go away. They end up overusing, have an accidental overdose. Somebody shows up and is able to provide Narcan to save their life. And then there's all of this shame and judgment and fear about going to the hospital and having to say, this is what happened. So we really want to encourage people to have the courage to stand up for yourself, to seek support, to not be, I don't want to say don't be afraid, because it is, it's frightening to have to face some of your problems like that.
Yeah. I think sometimes people think, like we have you on because you're going to speak to somebody who has an addiction problem, and that's going to make them pick up the phone. That's not it. That's part of it. The other part, though, is the folks who might have that attitude towards people that have an addiction issue, right, is to educating them, to let them know, hey, there are people out there that struggle with this. This is a struggle. Mm-hmm. So
exactly.
Sometimes that quick response of, well, why would you do that? Or you have to understand there's a lot that goes into this.
So both of those things. I would hope that if somebody was listening and they said, I've been thinking about this, I think I've been drinking too much, or I think I've been misusing my prescription, or, have gone into, I couldn't get another prescription, now I'm buying pills. If someone's listening and wants help, I would hope that could happen, that they could reach out to their local county drug and alcohol program, because they do even just a screening by phone. So you can say, I think I have a problem. Here's what's going on, and they can do a brief screening, and then they can get someone scheduled for an assessment if they choose to at that time, and then talk about what level of care you might need. Maybe it's just some outpatient counseling to talk through it, some recovery support. Maybe it's intensive outpatient or rehab or a detox program. There's a whole range. So it just starts with that phone call to really have the courage to say, I've been thinking about this. I think I'm struggling. I think I have a problem. I don't know where to turn. But I also think the other side of the coin, as you said, am I speaking to people who have judgment about substance use? Absolutely. It's a very, very big part of the work that we do on our grant projects. Because if we can't reduce stigma in our communities and people don't know where to turn, it's like we're getting at the, I've heard somebody say the phrase I really love, we're getting at the weed from the roots. So we really want to like dig deep to address stigma so that when people walk into a hospital or to a counseling clinic or to their church or to a family member, that instead of getting backlash, they would hear somebody say, I'm so sorry, I can't imagine how you're struggling. And it took so much courage for you to tell me, let me see where we can get you some help. Like imagine how differently that would go versus, I can't believe you're drinking again, or I can't believe you're still using these pills, and I told you you're out of here if you continue this, and you're ruining your life. You know all those things on the inside already. What you really need is somebody to care and listen, and you might have to care and listen again and again and again, watching somebody continue to struggle, like with any health condition. So addiction has similar relapse or recurrence of use and treatment outcomes as things like heart disease and asthma and diabetes. Like statistically, there are people with diabetes whose blood sugar goes up and down over the years, or dietary changes, medication changes, heart disease, asthma. They're all similar profiles. So it's just a matter of being patient and compassionate and talking with people in a way that shows that you care about them and that their health and wellness matters.
Where do those folks go to get more information? Is there resources that you have available? 'Cause I'm sure most people know somebody who is dealing with addiction of some kind, right?
Yeah, I think that when I'm out in the community, or even just our first conversations, where I could go to the Y or to a library or a doctor's office, people always know somebody who either in their personal lives has struggled or can share a client or a coworker or family member or friend who's struggling. It's very, very common. Millions of people are struggling, but millions of people are also in recovery. So we want the message out there to be that you can recover from this disorder. And then I derailed from your question about where people can get help. You can reach out to your local, they call it Single County Authority for Drug and Alcohol. You can call your substance use program at your county. We have a website for our grant project, recoveryisnwpa.org. And if you scroll to the projects, there's a calendar for all kinds of events and sober activities. We have resources at our partners in behavioral health. I actually work for Western Behavioral Health at Safe Harbor in Erie, and work closely with other agencies and hospitals in the area on the grant project. So we're all working together. And if you reach out to your family doctor, your pastor, and say, can you help me find where to make these calls? You start with your county and just call the drug and alcohol program and ask for where you can get help. You can get help regardless of your ability to pay for it. Counties will often pay for that. Turn your insurance card over and call the 800 number and ask what your coverage is and who is covered under behavioral health or drug and alcohol. So there are a lot of options, but if you've never asked, it was a good question that you asked, because people will say, hey, now I'm not sure, like I think I want help now. What do I do? Where do I go from here? I don't think I can pay for it. Big message we send in our grant projects is put it out there all over communities that you can get treatment regardless of your ability to pay for it.
You have a link to some information where it's okay to think or ask your kids, or to have this conversation, right? Where my kids wouldn't do drugs. Well, it's okay not to just use kids either. You've had interviews with doctors and professionals that have gotten into addiction issues, and it doesn't matter who you are or what status you have in life. If you think there's something going on, you should probably look into that, or ask, or pull them aside and say, as you were saying, instead of like, I can't believe you'd be doing this, but be more supportive of it.
Well, and Yes, I think that it starts with those conversations, and it can be any age, any walk of life. So we don't want to get pigeonholed into a profile of what we think somebody with addiction looks like, because anybody can struggle with addiction. Many people were prescribed an opioid, and they are very addictive substances. So they end up maybe using too many, especially in agricultural work, farm work, that you have to get back to work. So you might be taking your medication, and then you get to the end of your medication, and sometimes you can't get more of it, or you've been using too much of it. And that's not a slight on anybody working hard or to say that they do that more often than anyone else, but it's very common that in rural areas that can happen because nobody knows how to talk about it or where to talk about it, because we're all trying to do it alone. But yes, just asking the questions is the beginning, whether it's your kids, whether it's a family member, just to say, hey, no judgment, but I can see that you're struggling, or I've been worried about you lately, and no judgment at all, and really just want to help out.
Do you find that more people are open when being approached that way? Or is there still, again, that stigma of, well, I don't want you to know, and I don't think I have a problem?
Well, I think it's not even the I don't want you to know, because knowing people in my personal life who struggle, I think there's maybe an awareness there. Yeah, I know I'm drinking too much, or yeah, I know it's going to be fine. I've got it under control. It's the denial that comes with the disease, that it actually changes your brain, and your brain wants more of that thing that will make you feel okay, because it becomes a compulsive behavior that needs you need that to feel better. So I think that, yes, you can say all those things, and a lot of people would say, I've tried to have those conversations with my wife, my husband, my mom, dad, sister, brother, child, that I've tried to have that conversation, they just get mad. Defensiveness is part of what comes with the disease of addiction, because you're trying to hide it in order to keep it going. So I could say in a compassionate way, I'm concerned about your drinking, or I've noticed you've used all your prescription and it's not due for another 7 days. They might get angry, might get frustrated, might try to deny it, and really just planting the seeds that you're a safe person to say, listen, I don't make any judgment. I just want to let you know I'm concerned and I'm here for you. That might be the only thing you can do at that moment. And the next step might be, if you ever want help, I'm here and I'll help you find it.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, and listening to it on the Allegheny News Talk Sports Network. Angela Morton with us here this morning, and you have an event coming up in a couple of weeks we're going to talk about before we wrap things up here this morning. But when it comes to your day-to-day, what is every day a little different for you and what you're working on?
It is, and it kind of changes because we have a work plan or a strategic plan that we told the federal government, here's what we're going to do with our rural area, and we're doing all of those things. But again, when I talk about trying to get at some of the roots of our issues in rural areas, there's some work on like processes and looking at the whole system. So our partners are so amazing, open-minded, open-hearted, to be able to say, we feel like we're doing a good job, whether it's hospital or a county drug and alcohol program or behavioral health. We feel like we're doing a good job, but we're aware there's always room for improvement. So whatever you need to do, at one of our partner hospitals, I have to commend them, because if I say, hey, can I talk to your operations director, can I talk to your facilities manager about having a picnic, no matter who I talk to, they're like, do whatever you have to make these connections so that we can impact this problem in the bigger picture. So there's a lot of nuts and bolts to the work of being out in the community and educating and reducing stigma and providing training, but there's also, how do we kind of shift the culture in these systems that are doing the best they can, but admittedly are a little bit broken in terms of trying to meet people where they are.
So really getting into this, the foundation's good, just some cracks that you kind of have to patch up a little bit?
I might use that.
Okay.
Yeah. Well, that's good.
Or do you have to, or are you finding you might have to rebuild the foundation? There's a lot of things where I look at, sometimes in education and other things where I go, well, you know what, maybe it's just time to completely change the dynamics of what we've known this to be. Have you not quite that far or that bad to?
No,
I
don't think so. I think that every team that we work with has a heart for the work that we're doing. They've agreed just on the ethics of not everybody is financially invested, but has invested time or staff energy. So it's really just out of plain cooperation of an ethical commitment to doing this work, which is really impressive. Yeah. So as a consortium, they give us the money and they're not giving it to one entity. They're giving it to a group in a region to do this work together. So I don't think we need to tear anything down and rebuild it. I think sometimes we're like getting out of a rut of the way maybe the things have always been done, and we need to look at, is it time after decades of doing some of the same things to shift how we're doing that, to meet people where they are, and to make sure that we're screening, and to make sure that people are showing up to, to the assessments, showing up to do the assessments, and really just making sure everybody's taken care of in ways that we already are attempting to do, but especially during staffing shortages due to the pandemic, it's sometimes difficult to be timely, and we know that there's an element of strike while the iron's hot when someone's disclosing that they're struggling. So we really want to build an infrastructure to make sure people are taken care of.
We've talked off and on about the stress that has come up over the last couple of years. Families are now dealing with all sorts of stresses in terms of prices going up on everyday products, gas prices, and maybe work isn't that great, or you're not getting a raise to compensate for that. There's a lot of just outside stresses, right? That kind of factor in. Are you seeing an increase in usage during these last couple of years?
So it's still, I think that as this wages on and moves forward, that we are different than we were a year ago or 2 years ago, but we're still looking at that. Like, the statistics are still rolling in on how the pandemic has affected mental health, substance use, like you said, families and stress and finances and priorities. So yes, actually there's one statistic that stands out in my mind, that it used to be there was a line we drew with, if you had X number of drinks per day and so many per week, for men, it was a little bit more than women. So it might be if you're having more than 4 drinks a day, or drinking more than 4 days a week, and I don't know the numbers well enough right now, sorry. But that number for women is now on par with men. Like, women were drinking as much as men now.
Oh, wow.
So, and opioid use went up for a couple of reasons. I think people were struggling and there was stress, and I'm not going to speak statistics about this, but when people go through a period of abstinence, like if you're not using because you're in rehab or you're in jail or you've been home or you can't even get to your dealer or to your prescriptions or whatever it is, that then you're going without for a while. And when you pick up again, you're at very, very high risk for an accidental overdose because your tolerance is low. So that's why in a year's time, from 2021 to 2022, I think it was April of 21 to April 22, there were more than 100,000 overdose deaths in America.
Oh, my.
So we unfortunately exceeded any statistics from previous years, that more people died of an accidental overdose from between 2021 and 22 than ever before.
Wow.
So it just compels the importance of the work we're doing to get out there. Even just this, talking about it, even if we just had a casual conversation every time about substances and what they do and how we can get help and reduce judgment. So if you don't want to be part of the problem, I'll say this, I'm going to be bold. If you are frustrated about somebody using drugs or society, or you have judgment about it, if you want to be part of the solution and not contribute to the problem, then try to reduce that kind of talk and that judgment and ask some questions. Try to understand better and be part of the solution by saying, hey, this isn't what I think about it, or here's not how I believe about it, but I can see you're struggling and I want to get you some help. So it doesn't mean you have to stop feeling the way you feel, but maybe check it and not be spreading that around society and contributing to that stigma so that people don't feel comfortable asking you for help.
You have an event coming up in 2 weeks that you're inviting
Well,
folks
we
to?
have lots of events. I should have
Okay.
made you a list and you can post it. But
Yeah.
really what I had talked to you about earlier, we're doing a lot of sober social events in Venango County and in Corey for National Night Out. We've now got another grant with Crawford County. So we have a lot of things going on in the community where families can get involved. But we have a quarterly online meeting of our grant. We share progress and updates about all of this. And that next meeting, we call it our community meeting, is via Teams, and people can reach out to me if they're interested. It's open to the public, and all you have to do is log on. You don't even have to turn your camera on if you don't want to. You can keep yourself muted and just listen in. But it's on Friday, July 29th, and it's at noon. It's a 1-hour meeting where we share updates. We have a speaker, and then we have a person in recovery sharing her perspective about what it's like to do this work and to be part of a community that's working to help people and support people in recovery. So that's Friday, July 29th at noon via Teams. People can reach out to me by email. I work for UPMC Safe Harbor in Erie, so you can either Google that and look for Angela Morton, or you can email me at my last name, MortonAL, at upmc.edu. And you can always find resources on our website, which is recoveryisnwpa.org.
Great to see you this morning.
Thanks,
Thanks
Luke.
for your time. Thanks for all you do.
I appreciate it. Thank you.
Take care.